Hey guys, how's it going? I hope that everybody's doing well and staying safe right now. I just want to say that I really appreciate you taking the time to come out and have this conversation with me. My name's Gabriella, and just once more, I'd like to stress the fact that I would love for this to be a conversation today. So if you guys have any questions at all, go ahead and feel free to speak up. You don't need to raise your hands or anything like that. Just find a right time to speak up, and I would love to hear your thoughts and your opinions. Furthermore, I want this to be a safe and inclusive space for everybody today, so if at any point anybody feels uncomfortable, you guys can go ahead and either excuse yourselves, or you can just excuse yourselves for a little bit of the conversation. Take a breather and then come on back. I do recognize that I'm a woman speaking to a room full of men, and there might be some things that I don't fully understand in your guys' experience, or questions that I might not be able to answer to my fullest extent. However, if that happens, I have a bunch of colleagues that would love to point you in the right direction with their answers, and that can maybe provide different resources for you. So go ahead and let me know if that's something that you guys would be interested at the end of this talk. Awesome. Moving forward, it should only take us about 5 to 7 minutes to cover what we're going to talk about for the day. So, again, my name is Gabriela Fonseca. I go to Arizona State University. I'm a junior, and I study medical microbiology. And over the past 2 semesters, I've been learning about HIV prevention, awareness, how to advocate, and I have absolutely fallen in love with doing so. I find that it's one of the things that excites me most about my educational career. And that's what I'm here to do with you guys today. I'm here to lead a conversation about HIV treatment, which again is so important for us to learn about. So let's go on and get into it. One more time, guys, if you remember last week, there is no cure for HIV. However, there are life-saving treatments that can offer somebody a long, happy, healthy life. But the only way to access those treatments is to get tested. And the only way that somebody can get tested is if they take the initiative to do so. Awesome. So we're just going to remember this week, if you get tested, you can know your status and you can break and prevent the cycle of HIV transmission and gain access to life-saving treatments. Perfect. So to start off these treatments, we're going to be looking over antiretrovirals. They're also known as ARVs, and they're given in a 3-drug cocktail. These are prescribed by a healthcare provider, and the actual cocktail is decided upon individual basis. And basically what antiretrovirals do is lower the amount of virus that is inside of somebody's body. So the first, potentially most important thing that antiretrovirals are going to do is lower that amount. Second, if they're taken soon enough, they can actually lower somebody's viral load, the amount of virus that's in somebody's body, to a level that's called undetectable. And when they're undetectable, it's untransmittable. So even if they were to have sex with their partner, it would be untransmittable to them, which is a super important thing, and that's what we would absolutely love for people to strive for. Perfect. And the last thing that antiretrovirals do, which is also very important, is prevent the actual virus itself from being able to mutate. So if somebody were to miss doses of their antiretroviral, or if somebody were to not take antiretrovirals at all, there's the opportunity for the virus inside their body to mutate. However, antiretrovirals, when taken consistently and as directed by their primary care physician, are going to they're going to avoid that process, which is super important and definitely yields in keeping somebody healthy and stopping their progression to AIDS. Perfect. So we've got antiretrovirals. They're really important to be taken as soon as possible. So anybody who tests positive for HIV should or can take antiretrovirals, and it's really important that they're doing so as soon as possible. This means that their bounce back to recovery is going to be the most efficient and the most profound, and the less damage will be done, which is why they're able to bounce back to the state that they were previously. Perfect. So there are 2 other methods of treatment for HIV, or a preventative treatment for HIV. So the first one we're going to start off with is PrEP, which is pre-exposure prophylaxis. PrEP, one more time. So PrEP is taken by anybody who believes that they are at high risk for HIV, and they consult with their doctor and get the script for it. So PrEP works in the body as a preventative measure. It's taken once a day for the duration as long as somebody believes that they need it. Alternatively, there's PEP, which is taken up to 72 hours after exposure with a known exposure to HIV, and it's taken once a month for an entire month, and it reduces the progression to somebody contracting HIV, the HIV infection. Awesome. So now that we've gone over all of that, I really appreciate you guys taking the time with me. Again, I do understand that I am a woman speaking to a room full of men, but I do just want you guys to know, if you get tested, you can know your status, and knowing your status leads to be able to get access to life-saving treatments, which is absolutely vital if somebody were to test positive for HIV. So again, if you guys have any questions, you can go ahead and let me know. I would love to answer them, and I truly appreciate you guys for coming out and having this conversation with me. Have a great day, guys, and I'll be over there if you guys need any questions. Thank you.